Hi guys, this session is all about gastroenterology. Okay. Now, before going to the gastroenterology code sections, we need to know the exact anatomy, the structures that are involved in this alimentary tract or the digestive tract. Okay. So we know the alimentary tract begins from the oral cavity. So in this oral cavity, we know which is the lip. The lips form the outermost pathway of the oral cavity. You should be knowing two things. One is the oral cavity and then the vestibule. What is vestibule? The region that we normally brush our teeth, right? The space in between the teeth and the lips is called as a vestibule, and the space that is posterior to the teeth is called as the oral cavity proper. Okay, now coming to this vestibule, we have this lips. We have the upper and the lower lip. You can see fair people with especially red lips, right? So this red region of the lips is called as the vermilion. And you can find a border that lies between this vermilion, that is a skin, and then the mouth. So this is called as a vermilion border. Normally we would say that as kumkumam, or this reddened area, which is a vermilion. Okay. Now let's see what are the procedures that are taking place in the lip. So we have a lip biopsy. We have a specific code. So normally when they are taking a biopsy, they might take a wedge biopsy. A wedge is actually a shape where the base is tapering and the apex is flat. Okay, a kind of more or less like a triangle. Now coming to lip shape, so this is otherwise called as vermilionectomy. This procedure is commonly done for precancerous conditions like actinic cheilitis. Next is the lip excision can take place either as a wedge shaped or as a V shape. Now when there is an excision of lip, now how about the closure? So now based on the type of closure, our codes vary. First is a primary closure. They are going to close it primarily. Next, they are going to take a flap called as a S-lander flap or the Abbey flap. Here, what they are going to do is, they are going to take a flap from the cheek and then they are going to place it on the lip. So it's like a fan-shaped muscle will be, or a flap is being created. That as an S-lander flap. We also have another thing called as a cross-lip flap. Say for example, the patient has a lesion on the lower lip. Now the flap is being taken from the upper lip. So the flap is taken from an uninvolved lip and then they are going to close the lower lip. So you need to know whether it is a fan-shaped flap or is it a cross-lip flap. And when the patient develops cancerous conditions, they might also go in for a resection. So here you need to know, are they resecting the portion of the lip? Is it going to be less than 1/4 of vertical height or more than that? So all these dimensions should be documented so that you can arrive at the right code set. Once a lip is resected, we'll have to go for a repair. So repair of lip, either it can be limited only to the vermilion. So we have repair of the vermilion border alone, or then and you need to know whether the repair is being done to at least half of the lip area or more than half of the lip. So depending on that, the extent of work that is involved, our codes differ. Okay.